My name's Callum Rall.
I'm Jane Browning.
I'm Becky Bunn.
John van der Pooy.
Jane Watkins.
My name is John Curnow.
Brenda Hollier.
Hannah Freestone.
My name's Adrian Nichols.
My name's Paul Ashwell.
I'm Simon Pendleton. I'm the clinical lead podiatrist for the Vulnerable Foot team.
I'm a highly specialist home enteral nutrition dietitian.
I'm a respiratory nurse specialist.
Cardiac exercise physiologist.
I'm in the hotel services.
I'm a ward matron at Hawkhurst Community Hospital.
I work for the health improvement team.
I'm the estates compliance manager.
I'm a senior clinical nurse specialist working in HIV.
I'm a therapy assistant and I work here at Hawkhurst Community Hospital.
I'm a health visitor. I work for Kent Community Health NHS Foundation Trust.
I guess I've always nursed and cared for people as I would want a member of my family to be cared for.
We're responsible for keeping the hospital clean and germ-free, and also to communicate with patients. And then, of course, those that are coming here for a while, we get to know them and hopefully cheer their day up a little bit.
Unfortunately, not all our families have the support that we want them to have from their own family, so it's quite important that we see them.
And it's not just about prescribing medication for them. Often it is taking time out just to talk about their disease and how it affects them, and managing their symptoms as well.
In particular, the children, when you see on the growth charts that they're starting to grow and thrive, it's just absolutely lovely.
We get them up and running, we can get them home, and the nice bit is that when they're here they're a patient, and when you take them home it's as though somebody's flicked a switch and you see the real person. And that's the big job satisfaction for me of what I do.
The service does a great job in trying to reduce the amount of patients that would go to the GP or will go to A&E, for instance.
To offer the advice and guidance around things like home safety, immunisations, and the things that we can use to prevent illnesses later on in life. You know, it's giving those children and families the best start.
You can't have a safe patient without a safe building. So we try to aspire to make sure that every environment that we do activity in is safe for the patient as well as for the staff.
We have the luxury of working across seamlessly between hospital and community.
I work closely with different specialties such as vascular, diabetes, sometimes with orthopaedics as well, so it's quite exciting and varied. If we get community care right and we get care closer to people's home right, hospitals can perform better.
We are sometimes that first port of call for some of our very vulnerable families.
We also go into schools and see children at school, in the special schools, and then at least once a year we'll go and see them at home with their family as well, and it just gives you that sort of that whole picture of what's going on in their day-to-day life, because they spend so much time at school.
We have our duty health line as well, which we all man, and families can ring in and ask us questions regarding health and feeding and to get general support.
There is a very close working relationship between nursing and therapy staff. We have social services working with us as well.
Then we had a major incident with a fire alarm fault. And again, the team worked together. We coordinated the incident through the relevant departments. There was massive team working between the integration of all the support services, whether that was risk management, legal, health and safety. We all come together and we really made a difference to the team to get that building back up and operational.
And we discuss patients who we are concerned about that may need that extra support, and do they need, the district nurses to go out, or extra social support from social services or Age UK.
We can prevent admissions and we can facilitate them when they really are absolutely necessary.
When you have helped someone to rebuild their lives and see the children thriving, we touch your heart, it gets going. It's a nice feeling.
Not just a cleaner, actually. It's a lot more to it than that. Having good communication skills and a sense of humour and a listening ear. That all helps.
You as a respiratory nurse are in that house, in that environment quite often, so you do build up a really strong relationship with the patients and their families and their carers.
They will call you and turn to you when things don't go quite so well, and they give you lovely feedback as well.
We've got a blind gentleman at the moment, so he's getting to know our voices, but you still go in there and say his name, good morning, and I'm Jane, getting to know your voice. But yeah, everybody, all the teams work well together, you know, and we help one another.
I think, you know, everybody feels as part of a kind of a big family, really.
The ability to come to work and know that you are able to give the very best for your patients, you get to know those patients, you get to know those families.
We do things properly as well, we don't do half measures. So it makes it an easy place to work for, but it makes it easier for us to do the right things for our patients as well.
Together we work through and we start them on a journey to the rest of their life.
While I'm not a surgeon or a consultant at the sort of front end of medical care, I feel that my job's still very important. Yeah, it is really rewarding, and that's kind of why we do what we do.
I chose to work in the NHS because I knew that I could make a difference.
We all work as a team, which helps, and this makes this place work, and that's why we do what we do.
And that's why we do what we do.
That's why we do what we do.
And that's why we do what we do.
And that's why we do what we do.
That's why we do what we do.